Hello and welcome to the ID Talk podcast. My name is Peter Counter and I'm the editor-in-chief of FindBiometrics and Mobile ID World, where we have spent the recent weeks focusing on new identity technologies in healthcare and how biometrics can enhance patient ID, electronic health records, and even diagnosis. That focus on healthcare was in preparation for the HIMSS Conference in Orlando, which since the original publication of this podcast has been canceled due to concerns around the COVID-19 coronavirus. FindBiometrics was scheduled to host an expert fireside chat about mobile ID in the healthcare sector, moderated by FindBiometrics President Peter O'Neill and featuring special guest Tim Brown, IDEMIA's Senior Director of Technology and Chief Technologist of Digital Identity for North America. This episode was initially intended as a preview of that chat, but it can also be heard as a standalone episode about this fascinating intersection of identity and health. In my interview with Tim Brown, we start off with an introduction to IDEMIA's mobile ID solution and the technology and standards that make it possible, before moving on to the specific ways it can be deployed in healthcare. Tim and I talk about patient ID, e-prescriptions, and telemedicine before speculating on the future of a mobile ID-empowered healthcare landscape. It's a fascinating conversation and a great way to keep the healthcare ID conversation rolling in lieu of HIMSS. So without further ado, I am pleased to present IDEMIA's Tim Brown on the ID Talk podcast. I'm joined today by Tim Brown, Senior Director of Technology and Chief Technologist Digital Identity for North America at IDEMIA. Tim, thank you for joining me today on ID Talk.
Thanks, Peter. Thanks for having me.
So before we jump into healthcare, we should review for listeners the fundamentals of IDEMIA's mobile ID solution. There are a few mobile driver's licenses currently live in the United States. How is IDEMIA's mobile ID solution different?
That's a great question, Peter. It's actually the first thing I'd like to talk about is a little bit of the difference between a mobile ID and a mobile driver's license. While they're fundamentally the same, I think there are some key differences that people may hear in the market segment that would provide some clarification. Mobile ID in and of itself is a mobile credential that resides on your mobile phone and allows you to authenticate and establish your identity remotely, whereas a mobile DL or driver's license provides a lot of that same functionality, but also conveys the ability to drive, to use it as a physical credential, as you would your physical credential.
Right. Yeah, that's a very important distinction. I imagine they're very easy technologies to conflate. Where are MDLs currently live and operational in the U.S.?
So mobile driver's licenses in general are actually live in several states, most notably Colorado, Louisiana, and Oklahoma, with several other states that are in pilots looking to go live in the next 12 months. Oklahoma, obviously, is our IDEMIA's mobile ID as a service, and while we feel that there are many advantages to our solution, I would state first and foremost that our mobile ID is the first operational mobile DL that is fully compliant with the ISO IEC 18013 standard for mobile driver's licenses.
Yeah, that's a major differentiator.
Obviously, the benefit of a standards-based platform is to ensure interoperability regardless of the jurisdiction of issuance. And AMVA has come out and supported that standard, and we all expect all the states to be issuing mobile DLs in the near future. And that's important, right? Because if I'm, as a Florida resident, pulled over by law enforcement or in California, I'd like to be able to have the confidence that my mobile ID can replace my physical credential with communicating with the officer. And the only way you can guarantee that is through standards interoperability. And then beyond the standards, I think some of the key features that we've implemented there's a host of security and privacy enhancing technologies that are built into it, most notably that put the citizen in control of their identity, as well as enabling online authentication. I like to refer to some of the technology as informed consent because I'm a big firm believer in not only establishing you own your PII, but also consenting to release it. And I think that's a big part of our application. A relying party or a consumer, somebody's out there, a business is asking for information about you, and instead of the DMV or whoever just pushing that PII out to them without your consent, we actually allow the relying party requests. It comes through, it gets pushed to you at your phone, and then you respond to that, and it and can give that consent to you. So it's a very active process between the holder and the relying party, rather than a passive or silent process for sharing your PII without your consent.
Mm-hmm. And that also fits into some one feature that I think is a really standout about IDEMIA's mobile ID is the pseudonymous data sharing as well, right? That's part of that consent?
That's absolutely correct. So another big feature of the product is that you have the ability to restrict the data that you're sharing. So you can say not only from the request coming in and what you can send out, but I can create privacy views of my ID. So when I go to a bar, I go to a restaurant or the convenience store to buy liquor or something like that, I can only show that I'm over 21. I don't have to provide that person with my name and address and all the additional information that could potentially be misused. And I'd also point out, and I mentioned this before, some of the states aren't moving directly to mobile driver's licenses for legislative reasons or budgetary or whatever. A lot of them are looking at identity federation with a mobile ID, and our product fits perfectly in that mold too. It's actually, we call it a mobile ID specifically because we think it embodies both this type of scenario where the state is looking to do an identity federation through a mobile device versus providing a driver's license. It can do both, and the deployment is standard for both.
In terms of a broader mobile ID, the IDEMIA mobile ID is international standards based. What are the main standards that IDEMIA complies for broadly with mobile IDs, and why are they important on an international scale?
I think I would say there's probably four that the big four I would say are 18013, the ISO standard around mobile driver's licenses. That's in committee draft. It looks like we're going to get it published. There might be a few tweaks here and there, but it's getting close. The next thing I would reference is ISO standard on 30107 Part 3, which is actually, while not directly related to mobile driver's license, actually talks to the presentation attack detection on mobile devices. And this is specific around biometrics, because a big part of mobile ID is establishing your identity at a remote location. That's a big part of it, or unlocking that mobile ID if you are going into age verification type of approach. And you want to make sure that the person who's standing in front of that phone isn't just holding a photograph of Tim Brown up, or or wearing a Tim Brown mask. There's a lot that goes into the presentation attack defense, and we conform to both levels 1 and 2 in that, which are essentially the types of attacks you would expect that could be managed or manifested without a whole lot of effort. Up to about, I think, $300 is the threshold of spending for it. Then there's a level 3 beyond that, but that's a super high level of sophistication that's involved, which may be necessarily overkill depending on your outlook or your view on this.
Right. Yeah. The level 3 testing that is currently available as of this recording, there are no biometric solutions that have met compliance.
The next thing I think, which is very germane to the healthcare market, is NIST 863.3, the special publication on digital identity guidelines. I think that's most of the healthcare work that we've seen calls out specifically that special publication, making sure that you're able to proof people to a certain level of authenticity, right, or authenticate to a certain level, and that's we've started the process of becoming IAL2, IAL2, and FAL2 approved under the Kantara Trust frameworks. That's ongoing. We provide for online authentication. We are supportive of OpenID Connect. So this is thinking, you think log on with my Google account, log on with my Facebook account, those types of prompts, but instead you're using your mobile ID to do that. Those are the big four. I think after that, our framework, our identity framework, is compliant to the Identity Ecosystem Framework version 1. We support FIDO UAF as an authenticator in the device. Obviously, you start getting into some of the standards around data protection and things like that, like FIPS 140-2. We also, from a federated identity perspective, support system, SCIM, or System for Cross-Domain Identity Management.
Yeah, it's really interesting when you kind of lay them all out like that, how much just understanding the standards that are involved in this, you really start to see the scope of what a mobile ID can do. But in terms of the other side of the equation, what is the user experience for enrollment with IDEMIA's mobile ID? I know you touched on the liveness detection, but it's interesting, I think, to always try and like put this in the hands of somebody listening, like what is this like to do?
Absolutely. I would say, I've been working with document proofing, remote document proofing for a really long time. And some of the biggest challenges that you run into are around user experience and coaching a user through successful capture of a document to be able to proof that remotely.
Mm-hmm.
So we've gone through. We realize that's a big part of successful enrollment, especially a mobile ID. So we've gone to great lengths to sort of tune and fine tune our process and do through data analytics and user focus group testing. We spend a lot of time talking to people, asking them what they like, what they don't like. We do A/B testing, that kind of thing, to try to drive successful enrollment. And it's something that we are constantly grinding over to get it just right and get it perfect. But essentially, the process is pretty straightforward. Again, we coach the users all the way through. We give them examples, videos, or in-app experience to try to bring them to handhold them, walk them through a successful capture. But initially, you connect your phone to the service. This is typically established using an SMS with a deep link, so you can, we establish some type of association in our system to that device, and that helps us confirm that the user is basically in control of the device. We then capture the front and the back of the physical driver's licenses. Despite the advent of mobile credentials, the physical credentials will still be with us for some time. But then we go for remote proofing. We capture the physical credential not just to validate its authenticity, which we do, that ensures that the user is in possession of the credential, but also we extract the data from the machine readable zone, which in the United States is the barcode on the back of the card. That allows us to have a solid read. We don't rely on OCR on the front of the card, and pulling from the PDF 417 barcode gives us that reliability in the data extraction. We then capture your selfie, and we incorporate liveness detection in our mobile application.
And what is that liveness test like?
We ask the user to perform several maneuvers with their heads that basically trace a path on the screen and pause at certain locations. And then finally, they submit that data. The credential data and the selfie goes back to our systems, and we pull from the state system of record and compare the attribute data that was collected from the driver's license. Compare that live captured selfie against the biometric that was there originally when the person walked in the door and proofed at the DMV, and that helps us establish that credential. And we throw in a few extra fraud vectors in there, checking for different types of fraud just to make sure. But then that's essentially it. That walks you through establishing that the device gets rendered. You've got an image on the phone. We found most of the states are asking for us to render what their physical credential looks like on the device, and then we have some interaction that can go on with that as well.
Mobile connected life demands a revolution in ID, and IDEMIA is leading the charge. The IDEMIA Mobile ID is a digital credential based on your driver's license that lives in a fully integrated mobile app on your phone. The credential conforms to industry and international standards and functions like a physical driver's license that has been upgraded for a digital lifestyle, allowing you to securely assert your identity both in person and online. A mobile-centric profile with your picture, personally identifiable information, license class restrictions, and badges for supplemental data like veteran status or donor card makes everything easy to see and understand at a glance, while a validation button allows for real-time authentication. Other government issue ID types and sources are naturally also supported. Learn how you can participate in making the mobile ID a nationwide reality. It's time to put identity at the core of connected America by visiting idemia.com. And now, back to the podcast. We've talked a lot about the actual driver's license component of this, and you did mention healthcare. I want to stick specifically on healthcare because that's the subject of your fireside chat with FindBiometrics at this year's HIMSS Conference. Generally, what are some of the bigger use cases for mobile ID in healthcare?
The thing that jumps out first is patient ID. That's an obvious choice. I think that as we look to enable things like telemedicine interactions with picking up prescriptions and that type of thing, you want to be able to establish ID of the identity of a person remotely. You're not necessarily going to be doing this in person. Provider ID. So anytime a provider is interacting with patient records or prescribing controlled substances or doing anything that, accessing patient records, those types of things, I think will be obvious choices for mobile ID. So they, potentially doctors may not necessarily be in a location where they might be at home on the weekend, and I call my doctor and say, oh, my sciatica is acting up again. So then it can prescribe me a medicine or something like that to help relieve the pain when he's at home. So he interacts with his remote electronic prescriptions using his mobile ID. I touched on prescription pickup. I think there's we see Amazon lockers everywhere. Now I think there's going to be a move to, the various pharmacies of the world offering this type of service where you walk in, instead of waiting in line to interact with the pharmacist, you can walk up and establish your identity with a smart locker. Telemedicine again, telemedicine, sitting at home, and I've got a cold, and I reach out to my doctor through telemedicine. I have to establish my identity some way to make sure that he knows or she knows that they're talking to the right patient. If they're going to prescribe anything, that she doesn't accidentally prescribe something that could potentially be harmful to me. And then, of course, patient registration, and this is at home pre-enrollment type of thing. So I know that I'm going in for a procedure tomorrow. I'm going to pre-enroll and answer all the questions that they're asking, give them my insurance information. I can establish my identity with a mobile ID. But also, I would say walking into the hospital, and establishing my ID at an in-person kiosk, I think is also going to be an area. And not having to necessarily interact, but able to quickly establish my identity for the procedures.
The first example that you used there was patient ID, and I know that that's one of the most crucial areas in healthcare where strong identity technologies are needed. Just to dig a little bit deeper, how can IDEMIA mobile ID be used for patient records, and what benefits would that bring to patients and healthcare providers?
Absolutely. I mean, think about the way that if I go to my healthcare provider right now and I ask for online access to my healthcare records, and I forget my password, typically what's done is a series of KBA, KBV questions that have been proven over and over again that that hackers are more. I don't know what color the fire hydrant was on my street, and 20 years ago. So, but that kind of information is readily available and has been hacked and exposed over the years. And then even worse, pushing out a text message to your device and asking you to type in a code that goes there with SIM card hijacking and things like that. That type of system is rapidly failing us from a secure identity establishment perspective. So, getting secure online access to patient records, reestablishing your account, those are all crucial, aspects for mobile ID. Remotely accessing those things. Anywhere positive ID is required, whether it's picking up, your prescriptions at the pharmacy. You walk into a doctor's office, rather than giving my driver's license, how quickly I can exchange information. Pre-enrollment we talked about before. And then, of course, I mentioned earlier this idea of informed consent. I mean, I want to make sure that my data is being pushed to the right people in the right times. So I want to be able to give that consent through an app that at home to my providers to share that data. If my doctor wants to share my data with a specialist, then I want to make sure that I know that and I consent to doing it. I think the privacy and consent mechanism is a key tenet in our mobile ID design, and I think I'd be remiss in not mentioning that.
You mentioned a couple times already using the mobile ID for e-prescription. Clearly, there is a huge demand for this kind of thing. just in terms of just patients having the convenience of being able to use these as they like with the informed consent, as you've been mentioning again. But there are a lot of challenges that are coming up in terms of implementing these. My question is, what are the main challenges faced by healthcare providers in implementing this e-prescription that is in high demand, and how can Mobile ID help address those challenges?
Well, certainly, positive patient identification is probably the biggest challenge. Establishing that the person who's in front of you is that person, or the person who's picking up it has permission to do that, or is the correct person. I think those are, rolling that out. I also think the ubiquity of we've talked about the presence of and how soon states are rolling out these mobile IDs, or if providers are rolling them out, or it's a specific healthcare companies or something like that. The having access to getting those systems out can be very challenging. I know that a lot of, given my background in some of the remote ID proofing work that's been going on, a lot of providers, in the absence of a strong mobile credential, have rushed to using pure document authentication from a mobile device, which can be challenging because you're not necessarily guaranteeing the identity of that person through simple document authentication. You really need to go back to the system of trust, which is at the DMVs, with some kind of biometric check at the DMV. So just doing doc auth alone is probably not good enough to securely establish patient identity. And I suspect that in doing that, those relying parties or companies that are healthcare providers have realized the difficulty in implementing systems like that well. It's not an easy thing to do. There are plenty of challenges just interacting with customers in that way, and interacting with IDs, and which is one of the benefits that IDEMIA brings to the table, right? So we've got a long history, 60 years, in producing IDs for the states in the United States. I think from a provider side, strongly identifying the prescriber is the correct person issuing the prescription. We talked a little bit about EPCS, or electronic prescription of controlled substances, before. Correctly establishing that to the DEA guidelines required, having a biometric match that gives you a false acceptance of at least 1 in 10,000, or at most 1 in 10,000, I should say. Being able to tie the user to their mobile device to do that electronic issuance of prescriptions. Consenting, back to the consent model, making sure that you have a way to consent to release medical data that's yours. Let's say a company I work for, or not IDEMIA, but let's say I started a company and they wanted to get my sensitive medical data. I'd want to know that, so I'd want to release that information only if I felt it was appropriate. Confirmation of understanding of potential side effects, interactions with drugs, that type of thing. I think if you look at our model for pushing information out, I can envision a pharmacy saying, okay, I'm a relying party for mobile ID, and I know that Tim's coming in to pick his prescription up. Let me push out a notice to him that says, hey, medicine A may cause this side effect, or medicine A is going to interact poorly with the medicine B that you're currently taking. Please consent to releasing, and tell me that it's okay, that you understand these terms and conditions, and send that out.
That safety aspect of it is really something that I know I'm personally very enthusiastic about when it comes to bringing strong identity and mobile ID to the healthcare space. E-prescription, and just prescription in general, seems to be a huge attack vector for fraudsters, and given the ongoing opioid crisis, it really does feel like having something like a mobile ID would really, really help prevent people from abusing the prescriptions, and then also B, making sure that the people aren't overprescribed codeine, for instance, to a point where it could become a problem. It feels like this could really help solve those public health problems, and maybe create a social good through technology.
Yeah, I absolutely agree.
Proving your age while enjoying a night on the town, opening a bank account from the comfort of your own home, registering a new vehicle remotely, IDEMIA's mobile ID enables all of these innovations and more. It can even replace your passwords. Mobile IDs incorporate powerful technology that roots them in government-held systems of record while allowing consumers to control when and how their data is shared. Convenient, secure, and more flexible than the traditional physical driver's license card or ID, this new technology empowers consumers to securely assert their identity on their own terms, both in person and online. The IDEMIA Mobile ID is more than just a concept. Statewide pilot projects and initial rollouts across the U.S. have already shown that consumers are eager for the next wave of converged identity, powered by IDEMIA and managed by themselves. It's time to participate in making mobile ID an American reality. Learn how at idemia.com. And now, back to the podcast. So you mentioned provider ID, and I think that when people think about a mobile ID, they're really looking at it from a citizen's perspective. But obviously, having a strong, anchor of trust and a trust chain in your device, especially something that can use NFC, QR code scanning, Bluetooth, that can have a lot of sort of enterprise level benefits as well. Can you expand a little bit about what the benefit of a mobile ID is for providers and healthcare professionals in a day-to-day basis?
Yeah, I mean, I think the healthcare providers and professionals would benefit from it. I mean, I think simply just from operating in shared workstation environments, having access to being able to tell who has access to patient records, whether they're authorized to do that. Having strong authentication in those locations to establish it. I think all those things factor really well into a mobile ID. I would expect that, we've talked extensively about EPCS, but I think that falls in line quite a bit. I mean, more and more work is being moved to these tablets and things like that in your doctor's office. I think that you see people, interacting with those things, having a standards-based mobile credential to be able to say, yes, I'm sharing this information. I'm establishing my identity. I'm carrying it. I can unlock it with my face or something like that. Now, I'll say this, that there are sensitivities to user experience in the healthcare space that could potentially that are challenges for mobile ID. Maybe they don't necessarily have the taste, I guess, for going and doing interacting with their phone just to unlock a tablet. So I think that's why there's a lot of presence of sort of, near field dongles or, those the types of tokens that they carry around in their pocket or something along those lines, which are a lot very more prevalent. But I think ultimately for establishing your identity and for important type of transactions like issuance of prescriptions, accessing patient data, recommending procedures, that type of potentially digital signatures on that data from a crypto certificate or something like that you're pushing out from your device to say, yes, I consent and I consent that this person should have this procedure, and here's my digital signature associated with it. I think those things all are very prevalent are required in the medical space or in the healthcare space.
Mm-hmm, absolutely. It really, it's really a two-side. There's identity needed on both sides of that transaction. It really does feel like, especially for healthcare professionals who are famously time poor, it does seem like it would be pain points for them.
Yeah, it's funny. I worked on a project probably in the early 2001, 2002. We pushed fingerprint readers out to a healthcare provider or a hospital, and the doctors quickly realized that they didn't want to use fingerprint readers because they could type their passwords faster, and they pushed them behind the monitor, and that was the end of that project. So I mean, it's interesting to. Like you said, they're time poor and very sensitive to that. So the quicker they can interact and do these things.
Turning our gaze to the future here, fully mobile ID seems to be an ideal solution for telemedicine. We've already talked a bit about home care, but especially as 5G and IoT technologies start to enable new levels of home care, I'm wondering, what is the potential of mobile ID in terms of enabling a sort of care from home model of patient care?
Well, I think, and I keep going back to it, but establishing, confirming identity is first and foremost, and I think that's what you're, having the ability to do that remotely, whether it's establishing it through our, a telemedicine session on your computer, interacting it with an authenticator into your web session or something like that, or interacting with, let's say you've got a drip, the morphine drip or something like that at home, and you want to make sure that I can unlock it and use it if for some reason I can do that through my mobile ID, and I can interact with those IoT technologies. I mean, there's obviously the ISO standard allows for that kind of interaction between a verifier and the device, but there's also a fair amount of work going on in some of the other standards bodies around authenticating a person to an IoT device or something like that. FIDO specifically, it comes to mind that they're doing work in this space. So the authentication aspect is very important. I think consent obviously is going to continue to be important. I see as use cases, that obviously telemedicine is the big one, but pre-screening, enrollment, that type of thing at home, preparing to go in. I think those are all going to be potentially huge. We will be doing these things sooner rather than later to prepare ourselves to go in, and interacting with our devices, our mobile ID will be a key part to doing that.
Mm-hmm. Yeah, I mean, having reported on this sector for 7 or 8 years now, just specifically in identity, I know that one of the big crunches in terms of healthcare providers is they're like trying to deal with outpatients and the sort of costs that causes, and so this is clearly it makes a lot of sense that this would be the high priority. We've spoken a lot about the potential of mobile ID in healthcare, but what are the immediate next steps healthcare providers and other relying parties need to take so that some of these opportunities can become a reality?
Call me. No, we'll be happy to help. IDEMIA will be happy to help, right? I would say if your state is a mobile driver's license provider, I think you want to educate yourself and understand the functionality that's there. How it can offer remote identity proofing or remote identity authentication for healthcare use cases. In the states that don't have mobile driver's licenses, that I suspect the states are moving towards branded mobile ID initially instead. And then while they don't, as we mentioned, don't bestow traditional driver's license privileges, they do confer a secure credential that would allow you to transact remotely and in person. So I think that's, understanding the landscape in your specific state or states that your company works in. And both of those instances, I think, equally apply to healthcare providers and relying parties. I think from a healthcare provider perspective, they're interested in establishing the identity, and a relying party is interested in interacting with that identity, with that person. And then if neither of those things are true, you look to companies like IDEMIA who can provide a secure SDK or credential that can be embedded into your own digital product to be able to enable those types of use cases. I think that's probably the best advice that I would give. And also understand what the landscape is from a standards perspective as well. I know like I mentioned, 800 NIST Special Publication 863 around digital identity guidelines. I know that heavily influences the healthcare market, and also look at some of the things around that the DEA requires and things of that nature. So those are all important things that you could do.
Well, I know you started off with a joke there, but on a serious note, how can listeners contact you to learn more about what we talked about today?
Probably the best way is through email, and that is timothy.brown@us.idemia.com, and we can go from there.
Thanks so much, Tim, for joining me on ID Talk today. Very excited to see your talk at HIMSS in a week.
Absolutely, Peter. I appreciate it.
And so concludes my conversation with Tim Brown, IDEMIA's Senior Director of Technology and Chief Technologist of Digital Identity for North America. To learn more about the topics discussed in this episode, visit idemia.com. To read more about healthcare biometrics, stay posted to FindBiometrics.com. I'd like to thank Tim again for joining me on today's episode. Our podcast theme music is by Logomrad. I have been your host, Peter Counter. Thank you for listening to the ID Talk podcast.